And he would always then say, you're not expected to know, but you're expected to wish to know. And so today, Jennifer and I are going to talk about something that we should all wish to know, because for all the variety in this audience, in terms of the demography of the age, where you come from, what your interests are in life, there is a fixed certainty. We're all going to have to deal at some point in our lives, sooner or later, with either lingering illness or certainly with death. And Jennifer and I are going to talk about that today in a way that we hope will in the history of mankind in any one society. And one of the things that they're going to have to deal with is how they're going to deal with the end of their lives. So, Dr. Brokaw, your father's 72 years old. As you know, I have an anchorman's ego. I think I'm going to live forever. On the off chance that I don't, let's talk about what I should be preparing for. You know I have a living will, and your mother does as well. What else should we have? And what is it about that living will that we should know?
Well, first of all, I think the audience should know that this is really unscripted. And my dad and I have been going back and forth about what exactly we should talk about. And I'm going to take this opportunity to put him on the spot here, because I have no idea about your living will.
And unfortunately, I don't know a lot about my living will.
Well,
in fact, I'm not even sure where it is at this point.
That's the case for the majority of people, actually. Only 30% of Americans have prepared any kind of advanced directive or living will, and they can be used interchangeably. But, you know, most people have a pretty clear idea of how they want to live their life and how they want to die. So it's really remarkable that we don't take the time, and it really should be when we're, you know, as soon as we're of age that we start to think about this. I had a near fatal ski accident when I was 27. Came very close. I suffered a head injury. I thankfully came out with most of my neurons firing, but I had prepared no kind of directive at that stage of my life, even though I was a ER resident. And I'm finding more and more now that people who have prepared some sort of statement for their family leave their family in much better shape, emotionally, financially, and otherwise, than those who haven't. And it has occurred to me that my own parents have been quite remiss in telling me, you know, what's important to them. So I want to turn it back to you, Dad. I want to ask you, you know, what makes your life meaningful, and what kinds of decisions should I make on your behalf if you weren't able to speak for yourself?
Well, I think one of the things that you want to do is that I'm a realist, and if it comes to a point where I have some kind of a terminal condition, whether it's...
what does terminal mean?
Well, terminal, that there's very little chance of recovery, that no matter what they do to me medically, or if it's head trauma in an accident of some kind, we can extend his life physically, but we can't extend the quality of his life. That's what's important to me at this point. I have thought about it because I find myself in a lot of dangerous situations.
But you're giving me vague terms here. You're telling me terminal, you're telling me quality of life. What does quality of life mean to you? What are the specific tasks that...
I want to be conscious, and given who I am, I want to be able to talk and communicate with the people that I care about.
Okay.
And that's important. And I think a lot about severe spinal cord injuries. If I'm confined in some way at a certain stage in my life, I don't want heroic efforts just to keep me alive on a resuscitator.
Again, heroic efforts are a
problem. Well, I'm going to give you an example.
Okay.
I don't want to be put just on some resuscitation device of some kind, just a breathing apparatus just to keep me going, that there may be a glimmer of life in there. But, and this does raise the important thing, I'm not sure when we did the living will whether we had a lawyer do it or whether we had a doctor do it, and we need to get that spelled out.
In the majority of cases, it is an attorney that does the living will, which is, I don't know how medicine relinquished this really important task to the lawyers. There was a study that came out a few years ago that said that 50% of terminally ill patients, only 50% had any kind of advanced directive on their chart. Of those 50%, only 12 had prepared their advanced directive, 12% had prepared their advanced directive with a physician. And conversely, 60 to 75% of physicians who are taking care of terminally ill patients have no idea if their patient has an advanced directive or what the contents of those advanced directives are. It's really shocking, actually. I think it's a crisis in healthcare, and we have a very superb and technologically advanced healthcare system, but we've moved into such subspecialization that likely when you or mom are in dire straits, and I hope that doesn't happen for quite some time, we're not going to be talking to one physician. We're going to be talking to a lot of ologists, and they're each going to come in with a microscope or a magnifying glass, and they're going to look at their one organ that they're charged to take care with, and they're going to tell me, well, his heart looks better today. The kidneys are a little worse, but the heart is better. It's very hard to get any physician to look at the whole picture anymore and to give good prognostic information or good information that relates to the chance of achieving a recovery that would be meaningful to the patient. And unfortunately, because our primary care doctors don't tend to take care of us in the hospital anymore, you're often dealing with somebody you've never met before when you're making decisions for a critically ill family member or loved one. And the other big misperception, I think, is that the doctor's going to make the right decision for you. I tell this analogy often. In medicine these days, we're like the pilot of a 747 who's happy to fly the plane until there's engine trouble. And when there's engine trouble and it really looks like things are going bad, we come out to the passenger and say, well, your life is at stake here, and it's your body too. What do you think I should do? And we put families and loved ones in such a terrible position to have to make a myriad of decisions that they're really ill-equipped to make. So my focus in life right now is to help families and patients have the kinds of discussions that I want to continue with my dad when we have more time, because it takes longer than 15 minutes, so that I really get a sense of what kinds of decisions I will need to make for him to achieve the outcome that he wants. And believe me, it's very individual. I have one patient in my practice who was an avid Sierra hiker and one of the first vanguard of female attorneys. And she has suffered a number of strokes in the last couple of years, and she's now wheelchair bound. And I recently did an advanced care plan with her, and I said, you know, what's the minimum level of functioning that you want to have? And she said, well, 10 years ago I would have said that I wouldn't want to go on living unless I could go hiking in the Sierras. And now I realize that all I really want to be able to do is interact with my loved ones and direct my care, and I don't even care if I can talk to do it. I'm happy to communicate non-verbally. That really took me by surprise, and it really taught me that once we experience some disability in life, we do find ways that life is still worth living. So whatever you say to me today, Dad, I expect that you may change your mind in about 5 years, and I'm going to ask you again.
Yeah, I think that's a very good point, and that I'm thinking I should go back, get a primary care physician, a kind of quarterback in New York, because you're out here and may not be available if something happens traumatically to your mother or to me. And then share it with you, but share it with your siblings as well simultaneously, not just on a piece of paper, but we ought to have eye-to-eye contact, because even in my business, I've seen so many families that get so...
As a clinician to get the real answers. So at the end of the day, we still have to go to our doctors and we still have to talk to them. And please, if we're going to give one message today, it's, you know, talk to your doctor or talk to your parent about what your values are about your life and you know, the possible end of your life. I know many of you in this room are probably bicyclists or skiers, and having had that near miss for myself, I know that you just don't know what tomorrow will bring.